Alright, so for my project, I decided to do the benefits and risks of delayed cord clamping. So the topic of delayed cord clamping interests me because it pertains to the field that I want to work in. I eventually want to specialize in neonatal nursing, and I want to be able to implement current new practices and tested research into my nursing field. Another reason I chose this topic was because my mom had delayed cord clamping interventions performed with one of my brothers and my sister. She swears that they were healthier in their infant toddler years than my brother and I were, so I wanted to research this phenomenon for myself. And up there is a picture of me and my goddaughter. She is my whole world, and she's also kind of what influenced me to choosing neonatal as my field. My research question is, what are the benefits and risks associated with delayed cord clamping? First off, what is delayed cord clamping, also known as DCC? Delayed cord clamping is a prolongation of the time between delivery of a neonate and the clamping of the umbilical cord. Normally, immediate umbilical cord clamping is performed within 15 seconds of delivery, but delayed cord clamping is performed 25 seconds to 5 minutes after delivery or until the cord stops pulsing. This delay allows for the neonate's blood volume to increase by as much as 8 to 24% due to the flow of blood being allowed to transfuse through the fetal placental route. None of my articles use a theoretical framework, but I thought Parse's human becoming theory could be implemented in future studies. Parse's human becoming theory guides the practice of nurses to focus on quality of life as it is described and lived. Parse's model rates quality of life from one person's own perspective as the goal of the practice of nursing. I believe his theoretical model can be implanted in future studies because delayed cord clamping affects the quality of infants' first weeks of life. Among the articles that I found, 4 were qualitative and 2 were quantitative. The qualitative articles all had a grounded theory design in which they examined the process of the phenomenon following delayed cord clamping to generate a theory. For these articles, the authors used interviews, chart review, data interpretation, and bracketing to set aside personal bias. For the quantitative studies, one was true experimental and the other meta-analysis, and they used randomized control studies, literature analysis, observations, and physiological measures. If delayed cord clamping is performed, the placental transfusion time is increased. This can contribute increased blood flow to the fetus, between 1/4 and 1/3 of the total blood volume in a newborn. This increase in blood transfusion can reduce the possibility of hypovolemic damages, decrease intraventricular hemorrhage, increase amount of iron storages, thus decreasing the need for transfusions due to anemia, and lower the risk of developing necrotizing enterocolitis. Some risks that were discovered in these studies were increased bilirubin and jaundice, leading infants to needing photolight therapy. Another concern is hypertension developing in the mother, which can increase the risk of polycythemia in a newborn. Some limitations that I found among the research articles that I read up on were small sample sizes, lack of research on how long to delay the cord clamp, lack of research on congenital diseases and delayed cord clamping, lack of ethnic background influences, and the need for more research on the effects of term infants versus preterm infants. Some author recommendations that I found are that future research should be done on infants with various congenital diseases to see how delayed cord clamping affects them. In a controlled setting, in the case of an infant experiencing asphyxia, perform delayed cord clamping to allow oxygenated placental blood to transfuse to the newborn while performing resuscitating measures. And in future studies are needed to be conducted to determine the optimal clamping time for delayed cord clamping. Some personal recommendations that I have for future delayed cord clamping studies include keeping up with mom and baby and determining the long-term effects of the intervention. I would also like to have some client interviews done, see how mom felt during the procedure and how she felt about holding a baby while it was still attached to the cord. I would also like to see further studies to determine the safe amount of time for the delayed cord clamping. In summary, I believe delayed umbilical cord clamping has significant health benefits for newborns with minimal risk. The increasing evidence that delayed cord clamping increases hemoglobin levels and iron status, resulting in improved infants' neurodevelopment, decreases chance of anemia, increases blood pressure, decreases need of transfusions, decreases rates of intraventricular hemorrhages, chronic lung diseases, and necrotizing enterocolitis, should prompt healthcare providers to consider implementing delayed cord clamping more into practice. Being an option in birthing process, I think more patient education should be done so mothers know delayed cord clamping is an option and the benefits it provides. Client education should only be done if the provider has done the research on the delayed cord clamping first and are able to comfortably and fully inform the client and family of the cord intervention. And these are my references. Thank you for watching, and I hope you enjoyed.